Ever had a finger that suddenly starts clicking, gets stuck, or feels like it doesn't want to straighten properly? Maybe first thing in the morning, and sometimes you almost have to force it straight. A lot of people brush this off until one day the finger just refuses to move properly. This is not normal. This is trigger finger, also called stenosyntenosynovitis. Complicated name, but actually a fairly simple pulley problem. Normally, your finger tendon glides smoothly, almost like a rope moving through a tunnel. That tunnel is part of something we call the pulley system. But when that tunnel becomes tight, or the tendon gets irritated, things stop gliding smoothly. So instead of moving normally, you get this sluggish, triggering type of movement. And certain people seem to get this more, especially people doing repetitive gripping, gym users, manual workers, people constantly using tools. And interestingly, people with diabetes are also more likely to develop trigger finger. If your finger suddenly starts behaving strangely, don't ignore it. At first, it may just click, then stiffness starts, especially first thing in the morning, then pain, and over time, the finger can actually lock. Yes, true locking. Sometimes locked in a bent position, sometimes straight, and yes, people genuinely come in saying, my finger just stopped working. And right now, some of you are probably thinking, wait, my finger actually does that. Now hold on. Not every clicking finger means trigger finger. Sometimes it could be arthritis, joint problems, or tendon injuries can look surprisingly similar. So don't start panicking just yet. Depending on how severe it is, treatment can include splints, exercises, steroid injections, and sometimes a small procedure to release the tight tunnel. But if it keeps locking or becomes painful, please don't ignore it. Be honest. Has your finger ever clicked or locked? Comment below. This is episode 3 of hand problems you shouldn't ignore. Save this for later, and next up, we will explore the wrist pain most people treat like a sprain, but sometimes it's much more than that. See you on the next one.